Hello, everyone. Good morning, good evening, good afternoon, and welcome to another episode of the Realist Lens for researchers who keep it real. You may be a clinician listening to this podcast, you may be in health policy, you may be interested in complexity and all the other interrelated layers that are involved in this field. How do we navigate those? How does a realist approach help to make sense of this complexity? And how we can translate theory into practice or from clinic to practice in healthcare context. These are all really important questions. And there's a very special guest with us today that's going to help us unpack some of those questions, which is, of course, Pragati Hebbar. Pragati, hello, good afternoon. How are you?
Hello, Alejandro. I'm good, thank you. How are you doing?
I'm very good. Thank you very much. I'm very good. And I'm really looking forward to this conversation because I know that this complexity that we find in practice and in policy is really appealing to a realist approach and it can really help. But at the same time, sometimes it can be complex to see where to get started or how to actually translate it in a way that can be useful, applicable, and accessible. And I'm sure that our conversation will give some of those initial tips for individuals to get started. Just before we do that, though, I'd love for you to introduce yourself, all the work you've done with the realist community so far, and your journey to this date.
Yep, thank you. And hello, everyone. Excited to be here. I'm Pragati Hebbar, and I'm a dentist by training. And I transitioned to public health around 2013. And since then, my main area of interest has been in the space of policy and program implementation. Initially, it started more as supporting actual policies and programs on ground at the district and state levels, following which I pursued a research track and I completed my doctoral studies on the implementation of tobacco control policies in India. And that's where my realist journey started as well. Currently, I am one of the assistant directors at the Institute of Public Health in Bangalore, which is based in the south of India, and continuing work mainly in the areas of non communicable diseases.
Pragati, thank you so much. And I love how you're going to bring into this conversation that clinical practice that you have in dentistry, but also the research and the policy. It's kind of a very broad spectrum of experiences that you can really bring into this topic, which is complex, interrelated, and I know that there are a lot of barriers for individuals as we're doing this. And you've mentioned that you began your journey in clinical dentistry, and that process, then, as you got involved with public health, with research, and with theory driven inquiry, has led you to this process now of realist work and realist approaches. What started this initial transition? Because you said there was something that changed that made you go into that process. So what is it that started that transition? And how has your background influenced your approach?
Thanks for that question. Indeed. So, in clinical dentistry, it was day to day interactions with patients, treating them, and you can see the results immediately. But after a certain point, seeing the high burden of cancer, precancer especially, because throughout the 8 years of dental education, from where I started in the first year of undergrad to the final year of post graduation, the shift in the demographics of precancer itself was alarming. There were people in their early 20s coming to our clinics with precancerous conditions. And this got me thinking it's not solely the individual to blame here that they have this habit and that's how they ended up with this condition. Because my interactions reveal that there are so many things beyond their control. For some, it's a matter of saving a few dollars, a few rupees by just popping a pouch of smokeless tobacco that help them suppress their meal so they don't need to spend money on a proper meal. For some, it was about peer pressure to stay in that organization, that company, or that employment to continue with a habit. Some, it was even just role modeling. So, seeing movie celebrities and assuming that eating these products will not cause any harm. And then I realized that no matter how many years I keep treating patients one on one, I don't think the impact would be as significant as trying to do something more upstream. at the policy level. And that's where the shift of moving or transitioning into public health started. From there, uh, it's like that analogy, where there is a leaking tap. You keep mopping the floor, but no matter how much you mop it, unless you fix the tap, it's not going to help. So that was my point of in the career where I decided that no, I want to work a bit more upstream. So that's how I started. And this curiosity to understand implementation, especially implementation of policies and programs, was where I got introduced to complexity and the realist thinking. Now, how has this influenced my thinking and approach in realism? I think one was that the realist principles of just looking at the variety of the hierarchy of research. So, putting that aside and learning to embrace and accept different varieties of research, the kind of findings, but trying to identify what is the most important pieces of information, not only sticking only to RCTs or any complex methods, but also making it more accessible. So these were some of the things that helped me unlearn what I had learned in, say, my clinical practice, that there is only one fixed way of doing things, there is only one research approach which is the best. So those unlearning really helped me, and that's how I was able to embrace the complexity and move in the realist field.
Brilliant, Pragati. Thank you so much. And again, it shows, I think, the journey that a lot of clinicians go through, which is those observations in practice that probably make you think a little bit wider. Because in those instances, it's a kind of a cross sectional that you're looking at those snapshots all the time. And then when you zoom out and start looking at the causes, the complexity of these problems. I mean, you mentioned some fantastic examples like peer pressure or financial issues, and again, all the contextual conditions that can impact this. And what you just mentioned as well is fantastic around the nuggets of evidence that you can pick. It reminded me a bit of the Pawson paper, around digging for nuggets in all those different kinds of research. How can help us in those moments to answer those complex questions. And the unlearning process, I want to tap a little bit on that as well, because how was it that process for you? Because I'm sure that there'll be clinicians listening to this thinking about this, and they're probably a little bit scared around, oh, all this training and learning that I've done. All of a sudden, I have to add this new vision and this new way of thinking. How was that process for you?
True. I think that was maybe the hardest because initially we were so tuned to a linear sort of a thinking where this leads to this, and this is how it's treated, and that's how the process goes. So there was also a line that my friends used to say that once a dentist, always a dentist. You just look at it that way, you identify, you treat, and you're done with it. But to then slightly widen that worldview of ours and to say that, okay, I would like to look at other things that are happening in the background or other things within our reach that can be seen influencing our area of problem or interest. So moving from this linear thinking to complexity itself was a big sort of shift, a mental shift for me. And how a few of the things that helped was even just a conversation with my mentor on the topic of tobacco control. And once I got the hang of that configurational thinking of the kind of loops that we can create, it just suddenly was like an explosion of ideas or some new neural connections happening in my brain, because there were just so many levels to things. There were so many actors involved. There were so many interests that each of these actors brought. And then the world of complexity was right in front of me through example, something that uh, through a domain that I'm confident in. So for clinicians who have been working in any domain, be it ophthalmology, be it dentistry, be it any of the domains, in their own domain, if they are able to take up few issues and broaden their horizon, I think that would help with the unlearning process. And once we are exposed to those multiple layers, I think that also improves our openness to engage with different kinds of research, including realist.
Fascinating, Pragati. And I think what you're describing there is exactly what I refer to as those light bulb moments when you're getting first introduced into realist research, particularly evaluation and synthesis, and all of a sudden you go, oh, okay, that now makes sense. This lens, hence the name of the podcast again, the realist lens, and the glasses that you're putting to see the world, because at times you may have your dentistry lens and glasses, but then you change those lenses and it can really open your horizons. Absolutely.
I
I
must
just
say,
want
very
to
aptly chosen name, by the way. Yeah.
Yeah, no, yeah, thanks. I just thought that it would be and this is true not only for realists, but any kind of research. You always have that lens of viewing the world, and it helps you, of course, to embrace that complexity rather than simplifying it. Um, I want to just circle back to your work with tobacco control because I find that so fascinating. And again, that process that you've gone through from seeing those cases cross-sectionally in your practice to then go into more public health. And of course, now with the Realist study that you're doing related to tobacco control, how has the realist approach helped you illuminate those layered realities of policy and clinical practice at the district level in India? Because I'm sure that there's a lot of different ways that lens has helped you embrace those layered realities within tobacco control.
Yeah, definitely. I think the realist approach does help a lot in tackling such complex issues. So, firstly, like I mentioned, just moving from a linear thinking to embracing complexity through the realist lens was quite a shift. And just the principles are such that by the time you understand what are programs and move beyond the jargon, I think it all starts making sense there. Another point that was very important was about context, the stated focus on context. For example, the National Tobacco Control Program. It is a uniform program that is applicable across India in all states. Then why are the outcomes so varied in so many different states? This this question in my mind was kind of the starting point for my tobacco control work, that if there is one policy, there is detailed guidelines, and there is so much of um, capacity building, training, etc. on that, then why are the outcomes so different? And in conversation with my mentor, we realized that it could be a great case for putting realist approaches to practice. And that's how we went about it. So the focus on context helped us pull out specific details, which some cases where the context is similar, but the outcomes are different. And contrastingly, some places where the outcomes are similar, but the contexts are so different. So this, what we did was we picked 3 Indian states, and one of them was extremely well performing, one was average, and the third was quite lagging behind. And this contrast helped us pull out details, that what helped in some settings and what didn't. The another a couple of things that the realist approach has helped was about method neutrality. So there is a tendency that, okay, for these kind of research you only should prefer qualitative methods, or for another kind of research only quantitative. In realist, I think, since it was open and you are in a position to choose what best suits your study setting and what best answers your question, that really helped. And lastly, I think this entire concept that there is room for refinement, and there is need, in fact. It is an iterative process. You keep testing, you keep refining. That is the ultimate way that it was helpful to be applied in an Indian district sort of a setting.
Mm, I love that, Pragati, around all those areas that you mentioned, particularly that one that you said around method neutrality as well, that they're obviously being theory driven and the methods are there to help us test, refine, refute, confirm those theories that are coming in through either our evaluation or our synthesis process. Could I just unpick that a little bit more and just what were the the methods that you chose specifically for this study, because it may help some individuals that are in similar processes, or that are thinking around, oh, what shall I use? Just to give a live example, what were the methods that you chose, and why did you feel that they were the most useful in your case?
Yeah, great question. So I think what we started off with was that we would some assumptions that okay, there would be a lot of implementation data, and there would also be availability and accessibility of that. So once you hit the field, you get the realities of maybe there is barriers to access some amount of data. Also, the data quality itself is also varying in different states. Now that we had different states to compare, to find uniform standardized data was also a challenge. So what I used was a mixed methods. So we started with more of a quantitative data analysis. There were national level data sets available, which we analyzed, and that helped us and guided us in which states to choose. Like I mentioned, the better performing average and the one that was not performing that well. Here we used a lot of quantitative data, mainly proxy of implementation. So when you realize that you do not get access to direct implementation data, what are the other alternatives that we have? So we were able to use some proxies. What do I mean by proxy? For example, there is a provision of banning smoking in public places. And if we do not have the exact number of fines that have been put for that, another proxy could be how many percentage of people were exposed to smoking in public places. And there you have a data set and data point available. So things like that. So with after the quantitative phase, we then moved on to the qualitative phase where we had in-depth interviews with a lot of these policy implementers, basically at district level, at sub district level, and understanding their challenges and how they went about implementing the program. After that, we also had kept a component of observations, mainly just to help us triangulate, because there will be a lot of data that comes in through these interviews, but we also wanted to observe the field and its realities to make sure that there is these two data sets are speaking to each other, or are they contrasting. So this is how I went about in the first realist study on the tobacco control part, where at least the quantitative, the national data sets, followed by the interviews, and followed by observations. And for the refinement part, we went ahead with consultations. So we had policymaker consultations to guide us there.
Fantastic, Pragati. Thank you so much, because I think that that area of justification, particularly early career researchers or PhD students who may be listening about this, I guess in research you're always making choices, right? And those choices are going to be informed by the lens that you view in the world. So I love that process, an iterative process that you went through of including all those different data points to help refine those theories. In this case, you have a lot of different sites, you have policymakers, you have program implementers, people who are receiving the program. So it's quite a complex study with a lot going on. So I guess that you also maybe found some resistance to this kind of thinking, maybe even when applying for funding or anything along these lines. So I'd be really interested to hear the significant challenges that you found in applying realist evaluation in this complex real world policy context, and how you navigated those specifically.
Indeed, there were quite a few challenges. To share a few, the first one could be just the dearth of realist studies in the same setting like ours. When I started about 7, 8 years back on this realist track, there was barely, I think, one realist synthesis at that point in time on tobacco control. And my mentors only study realist evaluation in the Indian setting at that point. So, so that's how minimal sort of solved cases, or apply examples, live examples of studies that have been done. So that was a major challenge. But I think since my mentor had hands on experience of undertaking such an enterprise, that was extremely helpful throughout each step of the research. Another challenge was, I would say, realist interviewing, the as you posed, methodological challenges. So in this unlearning space where we are so attuned to our qualitative interviews, to shift gears and move to realist interviewing, and how even the tool design and the delivery and conduct of the interview differs, was something that was a challenge. But I think there was guidance evolving in this area, in this field, so that was helpful. Conversations with other realists was also helpful to put that into practice. Another important policy challenge, I would say, which comes with this method, is matching expectations. So, policymakers, the moment they hear the catchphrase of what works for whom, how, why, uh, immediately there's a lot of expectations. Oh, they are going to evaluate this and we are going to get all the solutions for the problem. And trying to negotiate and already set expectations right, that what are the components that you can take on in the study and you will have some answers for, was an important initial step that I could, anticipate and take. Otherwise, towards the end of the research, sometimes it could lead to disappointments, it could lead to some sort of miscommunications between the intended actors for whom we were doing this research in the first place. And lastly, I would say a lot of jargon of just around, say, the starting point of program theories, IPT, IRPT, PT, MRT, RPT. So we were just like initially drowning in that. That what is this program theory? And so I think a lot of reading helped to get a sense of that. But not only that, actually hands-on doing it with a few experts as well as people at the similar journey of ours, at the similar stage of the journey. Those conversations and consultations helped quite a bit.
Brilliant, Pragati. Thank you so much for sharing not only the challenges but also some of the solutions that seem to help. And I guess that there's so many layers in that. You have the actual um, research challenges. So as you mentioned, the realist interviewing of the policy and the expectations, as you say, when you go to policymakers and maybe say, they may want a yes or no answer, but the answer is most likely going to be it depends. And then that's something that some policymakers may go, oh, sorry, because they're more used to other kinds of approaches, certainly. And it's fascinating here you speak, Pragati, around all the journey that you've been through and the layers from clinical to research to policy, and you've probably seen it evolve through time as well, not only through the start but through the years. And I guess that if you're looking ahead, how do you see realist approaches evolving within health policy research? What are the opportunities that you see, and some of the again unanswered questions?
Yeah. Like you rightly pointed out, I think there's an immense growing interest, especially about realist evaluation, about implementation research in my settings, especially about just policy evaluation in general, how to make those relevant to policymakers, but also to the end users and the public. So, with this growing interest, I think there is also a space and a need to build capacity for a lot of people to engage in this approach, and also to for the policymakers and the commissioners, for them also to uptake the findings. Like you said, the findings can sometimes be quite contrary to their expectations, so we need to build capacity. And most of the currently available, say, courses, workshops, etc., are largely in the global north, and these can be quite limiting in terms of access for early career researchers, for those without dedicated funding streams, etc., to access. And even be it conferences or be it these kind of trainings, need to be brought a bit more in a space that can be afforded and reached by many more. And I think Rameses is a great resource portal, and that's really helped a lot of people to at least start off their journeys. But to help hone skills, there is a need and space to do that. In fact, I think your podcast is a great input in that direction to make it more accessible to a lot more people. And as part of the Realize project, we are also in the process of developing potentially a Realist course. We've run Realist evaluation workshops, and now we're in the process of potentially developing a course that may make it slightly affordable. Um, Lastly, I would say that also communities of practice. Uh, so we have recently, as part of Realize, also started an Indian realist learning network. So where we have a lot of enthusiasts who are interested, whose imagination has been captured a bit by the realist thinking, but who still need a lot of hand holding, a lot of discussions, etc. So, through this learning network, what we plan to do is to bring out these areas or gaps that are currently there and help fill those gaps with, be it literature or actual workshops, trainings, etc. So, I think maybe that's the way forward, as how I see it from my perspective here based in India.
Pragati, you just made me so excited just hearing you speak and seeing that vision and that, I guess, filter of just trying to help. And when we see the value of this approach and what it can provide to people, wanting to absolutely share it with more people in regards to training, in regards to language, in regards to all sorts. And I love hearing that and seeing the a community of practice that is engaged and is willing to do that. So that is fantastic. I guess to finalize some of the things we've spoken about, because you've given so many really useful tips and really useful experiences that you've gone through. If we were to summarize the three main tips that you would give to someone that may be going through this process, they may have gone from clinical work to research and now in policy. They may be working now at that more upstream level, as you mentioned, and they want to use these realist approaches in their work. And they'll listen to this podcast and they're going back to their day-to-day studies, day-to-day job evaluation program. What are the top three things, would you say, that would be really useful for that individual that maybe is going through a similar process that you did?
Yeah, great. Um, yeah, I think from my experience of a few realist studies now, I would say that the initial thing itself is the scope. So having clarity on the scope of your study, because as a PhD student, you really are full of energy at the start of the journey and you want to change the world, but to pragmatically think about your duration, your funding, your scope, and what will you practically be able to take on within that part of your journey, because you have your postdoctoral and other you still have a long way to go. So within these 4 years, what is the exact scope of your study, to have that clear while you're taking that decision on scope, to consider your access not only in terms of, say, finance and funding, but with the policy makers, the stakeholders that you plan to engage. What is the level of access that you have, and will that be enough to carry forward your realist study? Because you need that kind of engagement with the multiple varieties of stakeholders. And lastly, in terms of the methodology, I would say there's no shortcut to reading. So there is a lot of literature available now, guidance is available. So look up for your specific area of research. There might have already been studies in that space. And if you do not find enough guidance, then do not hesitate to reach out. I would say that don't hold back. There are people who have done a lot of realist studies in the field, and I'm sure if you reach out, they would be more than happy to help and, yeah, join you along. So,
Fantastic, Pragati. We've got scope, we've got access, and we've got reading. And I love what you've said there at the end as well, because when you join the JISC lists, for example, like the Ramsey's JISC list, and you ask those questions, people are so happy to share ideas, to share good practice, to share papers, to even debate and dialogue and to move this forward. So I completely concur with sharing and having those conversations. That's something that I found in my own experience, that every time I've reached out to someone from the realist community, they've been so open and so willing to share.
Indeed. Yeah. And that has shaped a lot of my learning and my journey as well. So, yeah.
Fantastic, Pragati. Well, on that note, and on the sharing and the accessibility and the scope and those really useful tips, we will wrap up our conversation. But I am so excited to continue our conversations, particularly in our views around accessibility and how we can make realist research more accessible to more people around the world through language, culture, and access. And for those of you listening today, I hope that you found it a useful conversation, particularly those going into that complexity between clinic and research and policy. There is so much going on, there is so much opportunity, and in a complex world, a complex lens will help you do that. Thank you very much for listening. Pragati, thank you so much for your time, and I'll speak to you soon.
Thank you.